This is all good news for people with diabetes. We know well from a lot of research that reducing hemoglobin A1C, control of diabetes, improves outlook to become almost normal. But all our drugs do have side effects, and it's now difficult to get most people into the normal range using drugs. And they're still dying younger, they're still getting complications. We kind of roll the clock back to recognize that type 2 diabetes wouldn't happen at all without people gaining weight, and the evidence is absolutely crystal clear on this. So if we can help people lose weight, there's a chance that they would get shot of their diabetes completely. And we know this happens with bariatric surgery. Can we do it without? So the DiRECT clinical trial was set up and funded by Diabetes UK to use the very best weight management program to help as many people as possible lose the weight and become non-diabetic, to gain a remission of their diabetes. And that was very successful. We found that almost half of our patients within 6 years of diagnosis could become non-diabetic. They don't have to pay the increased premiums on mortgages, life assurance, travel insurance, and they can step into a restaurant and regard themselves as normal human beings again. So the analyses presented at this meeting of the American Diabetes Association, there are 4 presentations, and we've shown firstly that the remission of diabetes is closely related to the amount of weight loss, and that amount of weight loss removes the fat which is accumulated in the liver, and it seems to be the liver fat which is driving the whole disease process. And we've gone a little bit further than this to say now we know that almost half of our patients can achieve a remission. How can we identify them at the very beginning? Some of this is down to who is committed and will they stick in. Are they going to lose 10 or 15 kilograms? That's 20, 25 pounds in weight, perhaps even 30 pounds in weight, because you need to do that for a long-term remission. We found no difference between men and women. We found that within this range, up to 6 years of diagnosis, there was no effect of duration, although we do know that longer duration makes it more difficult. We found that, interestingly, older people, relatively older people, were able to do a little bit better than the younger ones. And of course, the nearer you were to a normal hemoglobin A1C, so a lower hemoglobin A1C at baseline, gave a better chance of a remission, and having less medications. And so several of the medications, particularly sulfonylureas, seem to make it more difficult for people to gain a remission. So the next step in this is, of course, having made a publication for the general public and people with diabetes to see, the next step actually comes from our patients who are clamoring to say, give us a chance to achieve a remission. We know that reducing blood glucose with tablets and medications will improve our outlook, but can we do it without? Can we actually get a remission without the need for the medications? And if they can do that even for a period of 1 or 2 or 3 years, this is likely to have a legacy effect in the long term. And the great news is that the cost of doing this, of going through this program per patient, is probably less than the average annual cost of having diabetes, because it starts relatively cheaply, but as soon as you add in second and third medication and then start developing complications, this is a very, very expensive, horrible, disabling disease. So if we can get a few years of remission or even long-term remission, it's a huge psychological boost for the patients, and it's a huge boon for our medical services. Wow, there's an awful lot going on at this meeting. For me, a very early session, which was jointly between Richard Bergman and Barbara Corky, and they were talking basically about the origins of this disease, and both were saying in different ways, we must take our eyes off the blood glucose and the high blood sugar. We must look at the disease process, which is driven by high lipids in particular, and high insulin, and then think what's causing the high lipids and the high insulin, and of course that's gaining weight.